Hello students, this is the lecture on radiography descriptive terminology. Descriptive terminology is the terms used to describe the appearance, location, and size of a lesion. This information should be documented for all lesions viewed on dental images. Documentation is essential for legal purposes. A written description indicates that the images were interpreted, and if no interpretation is included in the patient record, there is no documentation that the images were even reviewed. Descriptive terminology allows the dental hygienist to describe what is seen on an image without implying a diagnosis. The patient's medical and dental history, clinical findings, signs and symptoms, laboratory tests, biopsy results are all necessary for the dentist to make a definitive diagnosis. The terms radiograph and X-ray are often used interchangeably, but it is important to know that they do have distinct and different meanings. A radiograph is the actual film that has been exposed, and an X-ray refers to the beam of energy or radiation. Radiolucent is that portion of the image that is dark or black after processing. Radiopaque structures are the ones that appear light or white on the radiograph. Unilocular radiolucent lesions are lesions that have one compartment. Uni means one, and the word locus means a small space or compartment. Unilocular lesions can be corticated, which means that the rim of bone surrounding it is very clear and easy to see, or non-corticated, which means that the lesion does not show a thin radiopaque rim at the periphery, and the periphery appears fuzzy or poorly defined. Multilocular lesions have multiple radiolucent compartments. The location must be described so that the lesion in question can be found by other practitioners and so that the progression of the lesion can be followed. Precision in describing the location is important for communication and documentation purposes. A periapical lesion is a lesion that's located around the apex of the tooth. Peri means around, apical means apex. Inter-radicular lesions are lesions located between the roots of adjacent teeth. The prefix inter means between. The edentulous zone is that part of the patient's mouth that does not have teeth. Pericoronal means around the tooth or the crown of the tooth. Peri means around, coronal refers to the crown. Pericoronal location is a lesion located around the crown of an impacted tooth. Alveolar bone loss refers to loss of the alveolar bone proper in the maxilla or mandible. It is not only seen with periodontal disease, but also with systemic illnesses. The size of a lesion can vary from several millimeters in diameter to several centimeters in diameter. The size often dictates the type of treatment that will be necessary. Documentation of the size of a lesion is important for future comparisons. The appearance of a lesion can be described as opaque or radiolucent. A radiopaque lesion located in soft tissue can be described as a soft tissue radiopacity. A focal opacity is a well-defined, localized radiopaque lesion on an image. A target lesion is a well-defined, localized radiopaque area surrounded by a uniform radiolucent halo. Multiple radiopacities that appear to overlap or flow together are referred to as multifocal confluent. A radiopacity may exhibit an irregular or poorly defined pattern. A ground glass appearance refers to a granular or pebbly radiopacity that resembles glass that has been pulverized. Some lesions can be a mixture of radiolucent and radiopaque. They often appear as a radiolucent area with central opaque flecks of calcifications. The mineralization can progress with time, and a predominantly radiolucent lesion with radiopaque flecks becomes more radiopaque as time goes on. A soft tissue opacity appears as a well-defined radiopaque area located in soft tissue. An example would be a sialolith, which is a salivary stone. The location of a lesion is important for communication and documentation. Radiopaque lesions may appear in the same places as radiolucent lesions. In that sense, the location would be described the same way using the same terminology. This concludes this section on descriptive radiographic terminology.